What's good is Dr. Mario Wallace, the founder and CEO of all things strategic and the ATS Academy. Today's lecture is Agile Science and its derivatives. Um, Before I go into the topic, I want to give you some context about myself. I have a doctorate degree in business administration, leadership. I am a balanced scorecard practitioner. I am a Lean Six Sigma Black Belt practitioner, a change management practitioner, and an Agile Nudge practitioner. Agile Science and its derivatives is something near and dear to me, given that I know the founders of the methodology. Today, I will discuss Agile innovation and Agile implementation. I will not discuss Agile diffusion. I will discuss Agile diffusion in another lecture. Unlike Lean Six Sigma, Agile Science is specifically designed for healthcare. Given that healthcare is a complex adaptive network that needs to be innovated in order to improve healthcare outcomes, address access to care, social determinants of health, health equity, and things like that. This particular specific methodology helps to get to drive solutions to address some of the concerns within healthcare. I am discussing the lecture more from a practitioner perspective than a scientist. I am explaining this concept from a practitioner to provide a new set of tools that practitioners can use specifically in the healthcare setting. Before I go into the lecture, I want to talk about the founders of Agile Science, specifically for healthcare. And the first person to my left is Dr. Jose Azar, who's the Executive Vice President and Chief Quality Officer at Hackensack Meridian Health. In the middle is Dr. Malaz Bustani, the actual architect of all of this. He is the Director of Senior Care Innovation and Director of the Sandra Eskenazi Center for Brain Care Innovation at Eskenazi Health, and founding director of the Center of Health Innovation and Implementation Science, and professor of medicine at the Indiana University School of Medicine. And lastly, Eric Holden is the chief healthcare engineer at the Center for Health Innovation and Implementation Science, and associate professor of medicine at the Indiana University School of Medicine. Now, the three of them actually wrote this book, which is their second book, the Agile Network. It actually covers Agile innovation, Agile implementation, as well as Agile diffusion. But this particular book helps to walk you through all the concepts and the foundation of Agile Science, as well as give you actual examples in which they've applied it. And the two models that's used for Agile Science are Agile innovation, Agile implementation. The two models differ in the first three steps. Agile innovation, the first step is confirm demand. The second step is study the problem. And the third step is to scan for solution. And as you can see, the fourth step is plan, evaluation, and termination, which is a third step in this particular model, Agile implementation. The first step of Agile implementation is to identify opportunities. The second step is to identify evidence-based solutions. And the third step is to develop an evaluation and termination plan. So let me explain the difference. As Dr. Malaz always say, he loves to use Agile implementation, given that it's a faster approach to finding solutions within healthcare setting. Since the second step is to identify evidence-based solution. And he says to identify these solutions, look within academic literature, academic journals, and academic databases. If there is a a solution that addresses a problem that you have identified within your healthcare setting, then do not create the wheel. Just take that solution and scale it up and scale it down to the size of your uh, healthcare organization or the specific unit that you're trying to address the problem in. You take it, you scale it down, you identify a termination plan when you plan to terminate that project, because when it comes to Agile Science, we are talking about iterative sprints that's between 30, 60 to 90 days. Terminate those plans within 30, 60 to 90 days based on the metrics you've identified that will determine the success or the failure of that sprint or that rapid iterative project. And you take it and you develop a minimally standard operating procedure based on the findings. When it comes to agile innovation, the second step is study the problem. If you search for a solution within an academic database, an academic journal, or academic literature, and you cannot find a existing solution that's published, then you have to look within the organization and identify workaround solutions that seem to work, or you have to identify steps that you can take and you can test, or identify or create a system that you can take and test, run iterative sprints on. And when you identify some level of success, then you take them, or you take that particular sprint project, you validate the solution, and you package it for launch. When I say package it, it goes back to the last step of agile implementation, which is develop a minimally standard operating procedure. It's basically the same thing. If you cannot find a solution, then you work in the agile innovation model. But we're going to talk about each more in detail as we get to the actual specific model. So the theoretical frameworks for Agile Science are three. One is complex adaptive network or systems or theory. The other one is network science. And the third one is behavior economics. So let me read to you exactly what all of this means. Now, as an agile conductor or change conductor, when implementing Agile Science in any healthcare setting, the change conductor needs to be an expert in understanding the concepts of complex adaptive systems or networks, network sciences, and science and behavior economics. They must really understand it, because all of it goes together. Before you can start to implement, you have to look at an organization within the lens of these three things. So let me read this for you. Agile Science and its derivatives follows a bottom-up method, emphasizing the ideas and thoughts of people directly interacting with problems and asking them for potential solutions. Meaning it's a bottom-up methodology. And that's why you see identify opportunities in agile implementation and confirm demand in agile innovation. Agile Science look at an organization from both top to bottom, but specifically from bottom to top. Meaning if new change initiatives are implemented or discoveries, or if we're seeking discoveries within an organization, people who are closely connected to the problem tend to look for workaround or solutions to make their job easier. So basically, Agile Science empowers those who are at the bottom of an organization and help them to, with resources, to understand how to identify a problem, how to confirm a demand or get buy-in from leaders, and how to help director level leaders or supervisors run iterative rapid sprints. So that's the difference, right? Going to the people who are faced with the problems every day and asking them for potential ideas and solutions that can be tested, not just to get ideas from them and implement those ideas, asking for ideas from them that can be tested. Agile methodologies view hospitals and healthcare delivery systems as complex adaptive networks composed of semi-autonomous yet independent individuals who interact with each other and their environment in various ways. Their decisions and behaviors are influenced by the network as a whole and by their unique experiences, backgrounds, and opinions. People within the organization they live within what we call a semi-permeable boundary. So this particular dot represents a node or a person within the organization. As you can see, a semi-autonomous adaptive human that operates in system 1 and system 2 thinking, right? System 1 thinking is thinking on autopilot, like driving home from work. Although you're driving home, you may not necessarily be focused and paying attention because you've done it multiple times. So it's easy for you to get from work to home. System 2 is a more deeper level thinking, a more analytical, strategic approach to thought. Well, whenever somebody has to respond to a question, they have to think deeply before they respond. Or if they're working on more higher level thinking things within their office or based on patients, studying data or writing research paper for academic journals, that is a more deeper level of thinking. Here's the thing about system 1 and system 2 thinking is that according to research, the actual human uses system 1 7 hours and 40 minutes a day, and system 2 just 20 minutes a day. People in organization are semi-autonomous adaptive humans who use system 1 and system 2 thinking. They have cognitive biases and they nudge, and we'll explain nudge in detail. So as you look at the semi-permeable boundary, the line is a link to another person. And these people communicate with each other through conditional interactions, meaning they conditionally choose who they want to engage with and interact with in an organization. It is not a situation where people are forced to have conversation with each other. No, people make choices on who they would like to engage with and interact with in an organization based on their own conditions. Now, as we see here, network of adaptive agents. So all of these dots are considered nodes or agents within the organization. The links to them are links, meaning who they communicate with conditionally. And as you can see across here from this particular cluster of people and this particular cluster of people, we can see there's 1, 2, 3, 4 clusters, or maybe 4.5 clusters here. But from this cluster of people to that cluster of people, there is a line, what we call a bridge, that bridges this cluster of people or a social group or a department of people to this particular group. So this node here, or this semi-autonomous agent here, knows this person as well as they are communicating with this person. So information from this group can easily be spread to information to that group, or they can be sharing information across both groups, but they're only sharing information within 1 or 2 people within those particular groups. To make this more effective, we would definitely try to connect more people within their group to help the diffusion of information. Center of a cluster is the person who has the most influence within that particular cluster. And this person we consider it with network science as the hub. So the person in the center is considered the hub of that social group. And based on a network mapping, based on administering a network mapping survey, we can determine who are connected to who within an organization. We can determine who are the hubs within those social network groups in order for us to help influence the social network. Now, the hub is considered the key influencer. If information needs to be communicated effectively throughout the social network, it needs to be communicated through the influence of the actual clusters. Unlike a hierarchy organization where communication or information is shared from top to bottom and bottom to top, complex adaptive network information is not only communicated from top to bottom, but also throughout the organization and networks. Now, from a hierarchical perspective, these people at the top, the executive leaders, identify problems and solutions, and they push them down into the actual employees who gathers according to social network based on conditional interactions. But as they push information down to them, when a change initiative happens in an organization or a new discoveries happen in an organization and information have to be diffused across an organization, as that information drops into the organization, people begin to scatter. And as they scatter, we call that self-organizing. It's not community organizing with there's a group of people doing it. They self-organize until it forms some type of social network. And within that new social network, based on the new initiative that the organization is implementing from the top, what emerges within that social network is a hub who is a key influencer of that network. So people trust information from the person who is the center of that network, which is the hub or key influencer, more so than they trust leaders who's pushing information down into the organization. Now, within a social network of a complex adaptive system, there are three things that happens as emergence begin to happen within an organization. As people discuss new ideas and discuss workarounds and things that they're doing with someone else, that conversation sparks what we call emergence. New ideas come from that conversation that could lead to some type of innovative concept that can be tested. Remember, in Agile Science, we don't take information and just use it. We take information and we test it multiple times until we see success in it, and then we implement it or put a budget behind it to implement it into the organization. Then order chaos dynamics happen. There's a pull between a negative and a positive, and that pull and that tug between people and new information tends to lead to some type of innovative idea. And lastly, self-organizing. As new information goes into the organization, specifically if it's top down, people tend to self-organize and start to identify with people who they think can help them understand the new changes in an organization, which leads to an emergence, because once they get into these groups and they begin to have these conversations, new things begin to emerge in those groups that leads to new discoveries. So the second theory within this whole concept of Agile Science is network science. And here's a quick definition. Network science is a field of study that investigates the structures and functions of complex networks. Networks are collections of interconnected elements, people, often called nodes, linked by connections and edges and bridges. Network science uses mathematical and statistical methods to analyze those connections and understand how they influence the behavior of the entire system. So within a social network that we saw within a complex adaptive system, because these theories build upon each other, we discuss social networks and network within that whole complex adaptive network theoretical model. But there are nodes, hubs, links, and bridges. The nodes are the people within the system. The hubs are the key influencers within the social networks. The links are the links that connect people together. But remember, though, these links are connecting people, but they're connecting based on conditional interaction. People are choosing to connect to whomever they want to connect with within the organization. It looks like that within social network mapping, because the type of question that are asked in the survey is, who do you get your information from? How often you get your information from that person? And who else do you get your information from? So it's seeking who is that person linked to. But remember, the linkage from one person to the next is based on conditional interaction. And bridges. So bridges is bridging one social cluster of people to another cluster of people. And to accelerate communication within an organization as it relates to diffusion of information is to diffuse information based on what the bridges are and who are the key influencers who can inform the social cluster. And the bridges is a path of communication to be able to communicate information that's happening in this cluster to information that's happening in this cluster and back and forth. So we need to understand what those bridges are. So this is back again. It's network science. These are bridges, these are nodes, and these are hubs. The center are the key influencers. They are considered the hubs. In an agile science practical solution, we tend to identify the hubs within these organizations, and we educate them on what we call the agile mindset. And the agile mindset consists of three things. Educate them on psychological safety, to be able to provide and practice psychological safety within their clusters. These gray circles are considered the clusters, the semi-permeable boundary, and these are the clusters within them, the people who are connected to one another. And then you have the center person who is the hub, or the key influencer of that particular clustered network. Well, we teach that person psychological safety because we want the people within the cluster to be freely communicating solutions that they may have. If the person does not provide a psychologically safe environment, then people will not speak up and people will not offer ideas. So the first thing the person has to be able to practice is psychological safety. The second thing is to be able to establish and run rapid iterative sprints to understand how to do it. So basically, you get ideas from people within the cluster. You create a termination plan, evaluation and termination plan that consists of metrics on and the time frame of terminating the actual sprint and how to run the sprint. The third thing is to be able to package those outcomes into some type of minimally standard of operating procedure that can be replicated and shared with other groups within the social network, so they can test them. Based on studying the social network, if you don't see all the connection that you need to see, that you want to see to influence the actual social network to diffuse or spread information within a social network, then you would have to identify additional bridges, what we call artificial bridges, to speed up and to accelerate these new discoveries or the spread of the new discoveries across an organization. Again, hubs are in the center, bridges connect people from one hub to the next. There's a link that connects one person to the next person based on conditional interaction. And lastly, there is a node. All of these dots are considered nodes. Behavior economics. So behavior economics combine traditional economic theory with insights from psychology to understand how people actually make decisions in the real world. Traditional economics often assume that people are rational actors who make decisions based on perfect information and self-interest. However, behavior economics show that people often are influenced by a variety of factors, including emotions, cognitive biases, and social norms. So remember that the foundation of network science are three theoretical frameworks: complex adaptive networks, network science, and behavior economics. So with behavior economics, there are three things that we need to focus on. One is cognitive bias, heuristics, and framing. So cognitive biases are systematic ways of thinking that can lead to errors in judgment. So then we have heuristics, mental shortcuts that people take to make decisions quickly and efficiently. And framing, the way information is presented can influence how people make choices. The way you communicate something, you tend to try to frame it in a way to 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 call the attention to people on how you framing it to basically influence choice without taking away options. And we'll explain that. So nudge is a choice architect that is designed based on behavior economics. It's a choice architect that's designed to influence thought without taking away choice, right? So basically, as you can see here, you have gray doors, you have one yellow door, and the yellow door is partially open. So basically, when you develop different sprint projects, you develop them with some type of nudge choice architect designed within the sprint that can nudge the people in a certain direction without taking away choice. If we're trying to get more people to eat healthier within in our cafeteria in a healthcare setting, we tend to have pies, pastries. When people first walk into the cafeteria, we tend to have pastries as one of the first things that they see. Or when they check out, we tend to have pastries or different types of unhealthy food items at the checkout. So when they're checking out, they can see those and they make a purchase. That's nudging them to do something. Well, if we want to nudge people toward healthier eating, we can take the pastries and move them further down and place the fruits in front. So when the person enter into the cafeteria, they see the fruit first. That is nudging them towards the fruits first. Or when they're exiting, instead of having candy bars and things near the register, we can have fruits near the register as well to nudge them towards that. So we are offering them a healthy choice without taking away without taking away their independent choice. We still have other items, unhealthy items on the bar, but what we've done, we've moved them and we situated the healthy items more up front so we can nudge them to consider that before they consider some type of unhealthy choice. So we develop nudge strategies as we build our sprints and we test them. So what is a nudge? Architecting the social, physical, and digital environment to facilitate certain behaviors without forbidding choice or without taking choices away. So there's three types of environments. You have a social environment, a physical environment, and a digital environment. When you're creating sprints and you're just trying to design a nudge to use and to test in those particular sprints, we have to ask ourselves, are we trying to change the social environment? Are we trying to change the physical environment? Are we trying to change the digital environment? The digital environment. That are three things that we have to consider when we think of designing a nudge. We first need to identify what are we trying to change within the environment? Is it social, physical, or digital? Now, agile innovation. We talked about agile innovation initially, but to get to this point, we had to go through the three theoretical frameworks that makes up agile science. Now let's talk more specifically about the two derivatives that makes up agile science. And the first one is agile innovation. As you can see, there are 8 steps within this methodology. The first one is confirm demand. The second one is to study the problem. The third one is to scan for a solution. The fourth is plan, evaluation, termination. The fifth is ideate and select. The sixth is perform innovation sprint. 7, validate solution and package for launch. Was 8. The first 4 is in the planning phase, and the second 4 is the execution phase. So what does that mean? Remember, this is top down, and this is a bottom up concept, right? We identify the people who are closer to the problem, who tend to always seek solutions or work around solutions to make it easier for their work day to day. So they're always seeking ways to discover new opportunities and new ways to do things if we only pay attention and listen to them and practice psychological safety and allow them to voice and express themselves about some challenges they're having with the current process in order to find ways to innovate it. So the first thing is, once these people at the frontline level identify that there is a problem and there is a potential solution for the problem, they begin to share this information with their director level leaders or supervisors. Now, the director level leaders or supervisors must practice psychological safety even to hear them, because if they don't practice psychological safety, then people sharing new ideas will feel that it's futile to take new ideas to the leaders because the leaders won't listen to them. And I say this because the first step in this model is to confirm demand. Somebody who's presenting information as a frontline person to a director level leader who has to then present it to executive leadership in order to get buy-in to actually run the iterative sprint, have to be able to sell the story to the actual leader. So they must be able to account for how much is costing the organization if this problem is not solved. How much is costing healthcare as a whole, healthcare within the region, and specifically healthcare within the organization. And they have to make that argument. They also have to make an argument on how long, what is a potential solution, and how long would it take for them to run some type of iterative sprint, such as 30 days, 60 days, and 90 days. And who would be on the actual team? Who would they select, or who would be on that team in order to help them to be able to design that sprint? So this information is passed to and presented to the director level leader, who begins, if the director level leader buys into the concept, begin to identify who should be on the interdisciplinary team to help carry out this sprint solution. Then that information must be presented to executive leadership. They must confirm demand on what we consider buy into the idea of running the sprint or running the project beforehand. Now, study the problem. So you confirm demand, you show there is a problem, then you study the problem in detail to see if there are people within the organization that already have solutions for the problem that can be tested. Remember, agile implementation is to identify a solution in evidence-based solution within academic journal, academic databases, academic literature, or through just knowing someone who actually worked on this problem before. If there is no evidence-based solution, you must study the problem first. So study the problem, identify the problems within it, and start to identify solution. As you identify solution, you build out some type of framework or some type of model or steps that you want to try and test. So you scan for solutions, then you plan evaluation termination. So now you've came up with some 5 or 6 type of models that you would like to use. You scan for solution within the models that you've identified, which one are the best. And these models could come from workaround solutions that's already within your organization. Then you build out a plan evaluation. A plan evaluation consists of the people involved, the team members involved in the project, their roles and their specific roles within the project, how long the project would be, 30 days, 90 days, or 60 days, or however long it is, and what the metrics are for that particular project. Because the metric tells the team when to start testing it to see if we're reaching those metrics or not, so that the team can terminate it within the time frame that they've identified, 30 days, 60 days, or 90 days. Ideate and select, look at those particular all the ideas that came up when you were studying the problem and scanning for a solution. You go ahead and you identify the one that you want to use and then you run or perform innovative sprints. You test it, you test it, and you test it. You either terminate it if it's not working within 30, 60, or 90 days, or you validate the solution if it is. And once you validate the solution, then you package the solution for implementation within the organization. So this is the concept of agile innovation. The main thing is confirming demand, because the information normally comes from bottom up, but sometimes leaders will identify a new innovative approach and push that information down into the organization. But the concept of agile science is bottom up. Study the problem, scan for a solution, plan, evaluation, termination, ideate, and select. Study the problem for a while, 3 to 90 days or 6 months, whatever it looks like. Scan for a solution as you're studying the problem. Create a termination plan, ideate, and select. Select the actual solution that you plan to test, and you perform the sprint, validate it, and you package it for launch, a replication across the organization. Then agile implementation. Again, there's 8 steps. The first step is identify opportunities. The second step, identify evidence-based solutions. Third step, develop evaluation termination plan. Fourth, assemble a team. Fifth, perform sprints. Sixth, monitor and perform implementation performance. And 7, monitor system performance. And again, develop a minimally standard operating procedure. So let's take one step at a time. Identify opportunities. Look within the organization. What is not working? What are the bottlenecks that you see? What social environment, what digital environment, or what physical environment needs to change? When you're presenting information to executive leadership, you have to be able to identify the cost associated with this problem. People move faster when they understand how much it's costing the organization. I'd look at it from a healthcare industry perspective and from your specific healthcare unit or system perspective as it relates to the cost. And who all will be on the team and so forth. So you have to sell this to executive leadership. Once you identify the cost of this problem, then you look for identify evidence-based solutions. You look across healthcare systems within the country or overseas. Look within academic databases, academic journals. If you identify a published study that explains a similar problem that was addressed in another organization, take it and scale it down. If it was implemented in an organization of 10,000 people and your organization only has 5,000, scale it down to be implemented in a space of 5,000 people. Identify and develop a termination plan. What are the metrics for this particular problem? How long we work on these particular sprints? And when will we terminate based on our timeline? Assemble a team, an interdisciplinary team that can help work this particular initiative. Remember, we're talking about working within a complex adaptive network. So the 3 things that we talked about in the first one is emergence. We know that when teams work together, especially an interdisciplinary team, there's always emergence of information that comes out of the team. So we want in chaos that takes place, and through chaos comes, and that's the pull and tug of information based on people debating and collaborating over information. Emergence tend to come out of those conversations. So we have to, what creates a sense of urgency and emergence in teams is an interdisciplinary team. So once we create the team, we test, we run the sprints for 30, 60 to 90 days. As we run the sprints, we monitor implementation performance. We continue to monitor the performance within the sprint, and then we monitor the performance within the whole health system or hospital in which we work, and how is it affecting other things within the hospital or health system. Then if we see success, then we develop a minimally standard operating procedure that can be replicated within other units within the health system or within other health systems beyond the one in which the sprint was ran and success was identified.